Okay, now you were referring to donors before and the government funds that goes into some of this area. Sometimes Nigeria situation can be very complex sometimes, no? Because if we go to investigate now, we see that several millions, if not billions of dollars have come to Nigeria for this issue not to resolve it. And the federal government will bring out a list of how much they have been spending. But yet, we will not see what they have spent it on. Um, anyway, I'm not going to go political. So, where do you see they really spending this donors' money and the money the federal government and even the state government are spending to resolve this problem? Or is it that they are not yet aware? What do you see on ground in terms of what they do or claim to do with the money they receive?
Well, I don't know. Like most times, the donor gives the money. Of a truth, most of donor-funded projects that goes to NGOs, they have tried. In fact, recently there is an organization that decided to pay for people, for vulnerable population, like 400, 500 people to go into to access health services. But this is just a minute percentage out of the so many people that need these services. So no matter how the donor supports, it can never be enough. You understand? It can never be enough. And the donor can say, okay, this funding that I'm providing is for specifically for this, is specifically for that. Is as in they have a defined work that they want you to do with their resources. So like for instance, now this sensitization, a donor can say, okay, sensitize the people so that they can pay for the health insurance. But where can the people get the money to pay? And the donor is not aware. Okay, for this particular donor that is not aware that the people now know about the health insurance but don't have the money, the donor decided to provide this particular amount of money to pay for about 500 people. So what happens to the other people? And you know, one thing about donor funding is that it is limited in the sense that you can only use it for a particular period of time, a year, 2 years, 3 years, and then what happens thereafter? How do the people now access services when there is no more donor funding? And that is why it is better you empower these people, subsidize the rate in such a way that they can be able to afford it and pay. Even if it is 5,000 naira, okay, say, okay, now you people in this place, okay, when you are sick, okay, pay 5,000 naira for 1 year, you can access. And of the truth, that 13,000 naira is just for one person. So when you ask a man to pay 13,000 naira, he will not ask you, is it for my entire family or is it just for me? And then when you say it's just for him, you will not like, I'm not interested. So what happens when I don't fall sick for the year? My money just goes like that. It's not refunded back to me. You understand? But if the money is subsidized, okay, in a year, probably it's not even all the family members that might fall sick. If they develop a policy that can be able to say, okay, you can register your entire family with a subsidized amount of money, I think it will go a long way in saving the lives of people, especially women and children under 5 years of age, because those are the vulnerable groups that really need healthcare services. And no matter how a donor invests in this category of people, that donors funds is limited. It, in fact, the number of people reach is will not even be enough. You understand? It's just to reach a percentage of people, and then thereafter, what happens? We still go back to where we were before. So the government really needs to do something. They really need to invest into health. Yes, every now and then we keep on saying government should invest into. Do you know that in some facilities you even go, you will not even see syringe to give injection. They will tell you you need to go and get your own syringe.
That
That's
is the question I wanted to ask you actually to talk about the facility. I mean, how effective are these facility even? Tell me about that because you work there.
okay. I didn't really work in a facility. I only went to monitor. So, like in one of the facilities, you find out that one, there are no manpower, there are no consumables, there are no. In fact, it was under equipped, but because it was under a donor funding, the donor were able to equip it with beds, with staff, and all that. You understand? And then they don't know how to even be paying the healthcare providers. Why? Because the money that a state government will pay you for working in a facility, you can imagine. I think last year I was in a meeting. One of the primary healthcare personnel was saying they pay like 12,000 naira in a month. So sometimes donors need will come in.
Like how many years ago was that?
Last year, sorry. And then she was even complaining that they've not even had, and the state government have not even employed staff. When you ask them, they will tell you there is no vacancy or there's no opportunity for that. And then there are more patients coming into the facilities, and there are no people. You can imagine going to the hospital from morning, and you'll be attended to by 4 p.m. since from morning you went to the health facility. So it can really be, somebody can even die in the process of trying to even seek health services. So sometimes the donors come in, they try to equip the facility, but they don't do it in all the facilities. They try to, like the project that we did in 2011, we went to rural communities, they equip it, they put in manpower, and they were still paying the staff. The staff were not comfortable staying in such a rural community, and then they do not have to build a house for them to be comfortable. Even when they were like, okay, they used to go to see their husband, they said, no, let's make it comfortable for your husbands to be coming to visit you. But after that donor steps out, what happens? Is there sustainability? Is there continuity? Because those healthcare providers, if they stop seeing such kind of money again, they will definitely not want to stay. They can only be coming once in a while. And you can imagine what will happen when a patient is being rushed to the hospital and there is no healthcare provider. But with them staying closer to the hospital, even if it is in the middle of the night, a patient comes in, they knock on their door and they come and attend to them. All these things are being funded by external donors. What happens to the Nigerian system, if I may ask? In the Nigerian system, you see, they will tell you that, yes, so many PACs have been equipped with this, that. Try and go there and see how many manpower is there. And then what happens to the other facilities that are in the rural communities? You go and see leaking roofs. You even go there, there's no healthcare worker. Maybe it's just attendants. In fact, there was a case of a man that went to remove his teeth, and then he was being attended to by an attendant. And then in the process, the guy died. So you can imagine those kind of things. No, seriously, it's not a funny kind of thing. It's really something painful that we really need to work on. And that is why it's not that we don't have the manpower, but our staff are poorly paid. And that is why when they have the opportunity to just move out of the country, they just go where they will be paid better. So what can the government do? What can our leaders do to be able to address these issues? Because these are really pressing issues that we need to address. It is not about going to one or two primary health care and say, yes, we donated beds, we did this, we did that. Looking at the coverage that that particular facility, if you see the thousands of people that that particular health facility attends to in a day, you even pity the healthcare workers. And then what happens to the ones that are in the rural communities that are being abandoned? Me, I know the one in my village. If you go there, it's leaking roof and broken windows. Nothing exists in that health facility. And then we once had a political appointee from my community, and he didn't do anything about it. So people should keep on suffering or what? We don't prioritize it. Why? Because when we are sick, they either fly out of the country or they go to a private hospital where they are being attended to. I won't lie to you, when I wanted to register for my health insurance, I didn't go to a government hospital because I know the crowd will be much. So I went to a private hospital where within 1-2 hours I'm being attended to, and I go. But how many people in the community can afford what me I